Indicator for Dr. Charette's hand wrist. Thumb and little finger opposition test. Indentation of the dorsum of the wrist. And it goes scaphoid, triquetrum, lunate, distal radius and ulna, carpometacarpal, carpal spread, distal row distraction, trapezoid, capitate, lateral hamate, medial hamate. Indicator for Dr. Charette's elbow radius, spongy or abrupt stop. And a cross fiber, position to adjust, preload in direction of sponginess, and impulse. Indicator for Dr. Charette's elbow ulna, feel for the sore spot on the medial condyle, cross fiber, and adjust. So indicator for Dr. Charette's shoulder, or the anterior humerus, have the fist in the air and the push the arm towards the feet. And it goes weak, so I'm going to pick one of the adjustments. I'm going to do supine alternate number 2 and adjust. Post check for the anterior humerus. Did I stop it again? Or? No. I'm going to test the AC and demonstrate the indicator and adjust. If I find that it's springy, I'm going to adjust S to I. Now the trigger points, number 1, subclavian, 2, mid-scap, 3 is teres major, 4, levator scapulae, 5 and 6 is anterior and posterior deltoid, 7 and 8 is anterior and posterior medial proximal humerus, and then 9 is subscap. Now I'm going to do the scapulothoracic mobilization. I'm going to move the arm up, back, down, then up and back down the other way. Now I'm going to do the SC mobilization. Having the patient look the opposite way. Superior humerus, the indicator and adjustment. Feel for spongy, and you want to adjust. Usually it will go while doing it. Next is the levator scapula tendon. I'm going to have the patient shrug her shoulder, and then I'm going to rub the angle of the scapula following the superior border as well. Part 2 is for Heron's elbow. Triceps muscle test with the wrist straight. It goes strong. So next I'm going to test the wrist flexed, and it's going to go weak. So I'm going to demonstrate adjustment for posterior medial subluxation and then posterior lateral subluxation, and then do a post check with the triceps muscles to test that it's strong. Triceps muscles test with the wrist extended is weak, so the brachioradialis muscle test, strong, would indicate posterior lateral. It's going to be a slip adjustment. And there's going to be a slip adjustment on the radius for posterior lateral. And the brachioverbalis test was weak, so it would be anterior medial, and you just stick it. And I'm going to post-check with, no I'm not. Yes, I'm going to post-check with the wrist extended, and it is strong. So now I'm going to test the anterior inferior humerus. I'm going to test at different angles greater than 45 and less than 45 weakness. So her shoulder goes weak at less than 45, so I'm going to do a seated adjustment. Going to put her elbow at the same angle that it went weak at and thrust on it. I'm going to do a post check to make sure that it's strong now. Next I'm testing the AC, the coracobrachialis muscle test. 45 degree out and 45 degree up. It's going to test weak. So I'm going to have her sit up and do the AC adjustment again. Now to post check, and it's strong. So now we are going to test her SC, the pec major clavicular muscle test. And not too strong. So it goes weak, and I'm going to have her lay in side posture. I'm going to have the patient lay in side posture, and then I'm going to place my pisiform on the clavicle and thrust to adjust. Then I will do the post check to make sure that it's strong, which it is. Now I'm going to have my patient flip on over to her stomach and check for her posterior humerus, which is the teres major muscle test. Going to have her come further off the table, support the arm, and then thrust. Then I will do a post check to make sure that it is strong still, or strong.